everybody, my name is Brian and I am a registered nurse with Nursing Now. Today's video is going to be about congestive heart failure, and I am going to give you some educational tips about how to manage your heart failure at home. Now, heart failure is a very prevalent chronic disease in the United States. It currently affects about 5.7 million people. It accounts for 1 in 9 total deaths, and the average life expectancy once somebody is diagnosed with heart failure is only about 5 years, which is very low. So today what I want to do is I want to be able to educate you at home about the signs and symptoms of what's called a heart failure exacerbation and how you can prevent heart failure exacerbations to hopefully stay at home and improve your quality of life. Now, before I get into the signs and symptoms of a heart failure exacerbation, I want to tell you what the difference is between a normally functioning heart and a heart that functions with congestive heart failure. Now, as you can see on the left here, what happens with the heart is that it pumps blood. Blood is received through the superior vena cava and comes in through the right atrium and to the right ventricle to be pumped out to the lungs first to be oxygenated. Now, this is so that the lungs can fill the blood cells with oxygen to then be returned to the heart to be pumped out to the rest of the body so that all your cells can have the nutrients they need to function properly. Now, what happens in heart failure is typically, for a multitude of different reasons, the walls of the heart are thickened and they're weak and they're not as able to effectively pump blood either to the lungs, to the rest of the body, or both. So what can happen is, in the same instance where you're receiving blood through the superior vena cava, this weakened ventricle here is not able to effectively pump all the blood that's received through to the lungs. Now, this can cause what's called peripheral edema, or swelling or fluid buildup around the legs, in the abdomen, or anywhere else in the body. Those are the most common places. Now, the left ventricle, also thickened here, is very weak, and it's not effectively pumping blood to the rest of the body. Now, what can happen here is, since the left ventricle is not efficient in what it's doing, fluid can build up in the lungs, causing shortness of breath, causing productive cough. This can cause other symptoms, confusion, difficulty sleeping, difficulty with a lot of other things. So, as you can see here, I have green, yellow, and red. Now, what I tell people is to think of heart failure as a traffic light. And when you think of a traffic light, you have green, yellow, and red. Green means go, yellow means caution, red means you need to stop. And in this case, when you're in the green stage of heart failure, this is good. This means you're not having any shortness of breath, you're not having any chest pain, your weight is stable, and you're not having any peripheral edema or swelling around your legs, your feet, or in your abdomen. Now, this is good if you start to notice any of the symptoms that I discussed earlier. You might be in what's called the caution stage. Now, this is the yellow stage right here, and what this means is that you're starting to develop symptoms. You might be having an exacerbation. This not necessarily is an acute issue, but what can happen is you notice that you may have gained 2 to 3 pounds overnight. You may notice that you're having increased difficulty or increased shortness of breath with doing some of your daily activities, such as getting dressed, brushing your hair, preparing a meal, or you're having difficulty sleeping. Now, sometimes this can materialize as you're waking up during the middle of the night and you're short of breath, or you're needing to use more pillows behind your head because you're having difficulty breathing, or you've moved from your bed to a recliner chair and you're sleeping somewhat in a sitting position because you're having difficulty breathing while lying down. Now, these are some signs and symptoms that you want to report to your primary care provider. This is kind of like the caution stage. You're having some symptoms, your body's letting you know that something's not right, and you want to make sure you call your doctor so that they know what's going on, and hopefully what they can do is they can intervene at this point before you're having an acute exacerbation and you need to go to the hospital. They might be able to change your medication, or they might be able to recommend some other interventions for you. Now, the main reason why I'm telling you about all of this is because I want to prevent you from being in these stages and going to this stage. I want to help prevent you from having to call 911 or having to go to the hospital. Now, the best way to do this is to pay attention to any of the signs and symptoms that might occur during the yellow stage or the caution stage. Now, if you're having an acute exacerbation, you may be in the red stage, which is very important that you recognize if you're in this stage, because you need to make sure you call 911 or seek immediate medical help. Now, some of the signs or symptoms in this stage you will notice are that you or your loved one is having extreme difficulty breathing. Maybe you've had to increase their oxygen and they're still having difficulty breathing at rest. They're having chest pain or chest tightness at rest, just sitting there. That's not been relieved by their prescribed medication. They're having these symptoms maybe along with some increased confusion. These symptoms you'd want to seek immediate medical help for. Now, I hope that nobody ever gets to this point, but if you do, it's important to recognize those symptoms and call 911 right away. I want to thank you all for watching this video on the stages of congestive heart failure. I hope you and your loved ones have found it informative. Please subscribe to my channel, as I'm going to be posting new educational videos every week. Also, please like and leave a comment below, and I will see you next time on Nursing Now.